Sometimes there can be too much help that's given, can create dependence. And then some teams have challenges if they talk amongst themselves, but nothing different really happens with the family. And so just kind of want to keep an eye out if you have a family that's involved in wraparound, if those things are happening, because you want to offset that if possible. So some of the challenges, so just I guess presenting some of the ideas, how many of you can think of kids that you've worked with that may not be in the right spot right now? That are more generic therapy. Okay, so there are a couple of people raising their hands. There's some real challenges, like now, once you kind of have this information is what do you do with it? So what happens if the current services are not effective? Some things we really want to make sure and watch out for is youth that are in services for a year or longer. So what's going on with that? You ask the therapist why they're there and they were building a relationship, right? I'm going to keep an eye out for that because it's not really a relationship. The therapist is getting paid to be there, right? And having a positive relationship with your therapist is a really important characteristic of getting better, right? We know that that's sort of one of those non-specific factors that is really helpful. But relationship as the key ingredient for therapy doesn't really get you where you need to go. And so while that's an important piece, it shouldn't be the only piece. And then, just youth that aren't getting better at all, we really want to change directions and get those youth connected up with maybe more effective services. And that can be a really difficult conversation to have with the current therapist, right? And with the youth. Yeah, here you've had a person who's worked on building a relationship with you for the past year. They probably take you out and do all sorts of fun stuff. You play basketball, you go and do, it's like, why wouldn't you want to stay with this person who you have this warm relationship with and then have to go do hard work and face your fears or do, these other things. And so you really have to navigate that a little bit. But in the end, what's in the best interest of the child, right? We want to increase natural supports, find people that can do what that therapist is doing in their own environment and get them the help that they need to deal with their mental health issues, right? And then, this last one's a big thing too. I have a little picture of the court here. But sometimes what's ordered for a family, and then what is going to be the most effective treatment are not the same, and that can be a real challenge. And so a lot of times we just recommend, for the caseworkers that we worked with in our project, they oftentimes would pass along the email exchanges that we would have about the needs of this kid directly to court to influence the way that the judgments were made on what kinds of services the family is required to participate in. So the extent to which, for those of you that are not psychologists right now, that you can build those kinds of relationships and have folks that can advocate for youth to change. We see this a lot, child welfare system and the court and juvenile justice system. Sometimes other people just have ideas about what the family needs that are not necessarily aligned with what we know are best practices. So those are all challenges that are presented with this information as well. But what I want to do now, I can do about 5 minutes to have discussion and questions. Okay, let's come up for folks. Yes. Does it seem pretty consistent? Yeah.
I've been thinking about this for so long, like the ethical responsibility of either a therapist or an agency to address the situation when a family or a client has been a part of their agency for years and, something is stagnant,
Yeah, and there's a disincentive because they're still getting paid, right, too. But at the same point, there's an ethical responsibility to have the family do better. So for those of you that work in agencies, how is that handled?
If you haven't seen movement for a while, what do you do?
So what are other people's experiences with that? Yeah.
Well, I work with foster youth, and so we would have to do a referral to either a higher level of care, a lower level of care, or a different agency.
So you try something different?
Yeah, we would try multiple things in our facility, and if that wasn't working, or if it was the youth wasn't happy and it just wasn't, then we would have to do a referral out.
Yeah.
I guess as a wraparound facilitator now, a lot of times therapists are on the teams that we have, and so in the meetings now it's like asking them, what are you working with the child, and I think I'm gonna start asking for like their treatment plan.
That is an excellent, I mean, I think that's one of the things that we have advocated so much for is having that relationship. If you work with a therapist who's not open to talking about that, like that's a red flag. That there's something that you don't, that, you want to make sure that you're having that open communication, that you're constantly having that conversation. I mean, absolutely, and that's fantastic that you guys have added the therapist onto the teams as well in general, but you're right, like having that access to the treatment plans that can give you a sense, are they actually fulfilling some of these kinds of things that we talked about here? Yeah.
I have a question. So my agency that I work for, works primarily with the Latino community. So when looking for programs for most of my kids that I have, they're 5 to 18 or in foster care, some or some are in kinship care. The difficulty is finding someone that speaks Spanish and also can provide those culturally appropriate services to the family. So.
Yes. I know, it's a huge issue. I do a lot of work in Central Washington as well, where there's a huge Latino population, and just kind of trying to figure out and navigate how you get. I think it's most important that you have a therapist that's sensitive to the local culture, right? Because a lot of these programs, there are only a couple. There is actually one Latino-specific parenting program that is available in small pockets of the state. But having a therapist that can just kind of walk and you can most of these programs you can implement if you have examples that are relevant to the cultural context of the family, whatever that context is. And so, but having bilingual therapists, that kind of thing, we just have a huge shortage in the state. We don't have an answer for that right now. I think that's a huge issue. I think that's one that people are aware of, and we're trying to think about what are the workforce development kind of strategies to get more diverse folks from, all, I mean, it's not just Latinos, are obviously a huge population chunk, but in Seattle we have a huge immigrant population, we have a huge, we have a lot of diverse families that we need to figure out how we do the best services for them.
Well, Sue, don't you think with evidence-based treatment it's less important to have a person who speaks the language of the client because you have an interpreter, it's short term, it's more curriculum based?
I think that's potentially would be true, but I would love to see some research on that, because I feel like, at least I know for some of the teams that I observe, I don't speak Spanish very well, but I know enough of it that I can tell that there's not always direct translations that are happening between when my therapist that I'm working with are saying something and then what's getting translated to the families. And I call that translator-mediated interventions because it's all kind of going through the translator. I think we need to understand how that process a little bit more. And one of the other, and we didn't talk about this, one of the real things with the parenting interventions is so critical is that practice element. So you're actually like there, you're role playing with the parent, you're having an opportunity to really practice the skills in the session. And how does that work when the timing is off, right? So I think those are things that we need to understand a little bit more about, but I certainly think compared to other types of services that children might receive, that's probably more promising.
Right.
And
the language aside,
yeah.
isn't it true that the research points to the fact that these treatments are just as effective
Yes,
for
if not
Latino
more.
or
Yeah, that's right.
populations?
Yeah, that's right. That's right. So, I mean, my preference would be to have a bilingual therapist that is also bicultural, that can understand, the cultural context of the families and be able to draw in those types of experiences and make these programs come alive for the families in particular cultural contexts. But we just don't have the person power for that right now. And so that's kind of the next best option that we have at our disposal. And there's certainly families that benefit dramatically, just even through the interpreter services. But I'd love to see some research being done on that area in particular. Good. I think we're just about out of time. Thank you.
Very much. Thanks for coming.